Hi and welcome to 90 Day Dental Day 24. So we've kicked off with photography and DSD with digital smile design yesterday, and today we're going to continue that theme by working on how to implement DSD in our practices with our patients. Continuing again with Elaine Halley.
Hello. So I would like to share with you some thoughts about how to talk patients through their smile using photographs. The tool that I'm going to use to demonstrate this is the DSD app, which is for the iPad, ideally an iPad Pro. So I'm sharing my iPad with you on the screen at the moment. The DSD app acts like a storage facility, so you can see, you can have lists of all of your patients. You can use the app, which is cloud-based, to store photographs of your patients' videos, CBCT scans, STL files, all of that. So I'm using this just to demonstrate. You can equally share and use other presentation tools or just your hard drives on your laptop. But I found the app is a good place to have everything together in one place. So I'm just going to show you a case on the tutorial section of the app. So I'm just going to select this patient here under Tiny. So what the app does, first of all, is the first step of smile design. That there's two reasons for going through this sequence. The first is for you and for your own diagnosis and treatment planning, and the second is to demonstrate the stages in which you can involve the patient with the various different decisions. So the first stage in using photographs to go through smile design is, first of all, making sure that your photograph is taken absolutely from the front. And one of the keys for this is being sure that you can see both of the ears of the patient. So ideally, glasses off, hair behind the ears, and making sure that you can see both sides of the face equally. You don't want patients that are tilting their head too much one side or the other way. The second thing then is that you're going to use the interpupillary line as a guide to where is the horizontal of the patient's face. So when we input a photograph into the app does this calculation automatically, and it also uses the intercommissural line to establish where is the true horizontal of the face. If you're doing this in Keynote or PowerPoint, you can rotate the picture and bring lines in to do it that way. So once we know what the horizontal is, then we can identify the facial midline using the glabella, the tip of the nose, the philtrum and the chin. So again, the app will make a decision as to where these points are, and we can move the picture around. If the person has a very asymmetric face, there's a whole concept of facial flow, which is also utilised in the app, which I'm not going to just now. But if the patient has a very asymmetric face, you basically have to just take a step back and have a look and make a call as to where do you think the facial midline should be, and then we're going to look at how does that correspond to the dental midline of the patient. So the next step on the app is just to calibrate the incisal line and the distal of both upper central incisors, and we can use these little targets to identify two places in the mouth that we know the measurement of, so say distal to distal of centrals. And if we then put in a measurement, that's going to enable us to calibrate the image. So then the app will guess or give an estimate of where the smile frame should be. So for those of you, if you think back to your smile design, what the smile frame is giving us is the incisal curve, which should run from the tip of where we want the central incisors to be to the tip of where we want the canines to be. It also gives us the relative widths of the anterior teeth according to the recurring aesthetic dental proportion. And we can change everything about this. So here I'm changing the length of the central incisor. She's had such small teeth that I'm thinking that she's probably going to be, whatever we do, feeling that her teeth are huge. So rather than using an 11 or a 12 millimeter central incisor, I'm going to go more towards how they are very small in nature, around 10 millimeters. And we can then, as I say, change everything about this. We can change our incisal curves, we can move the targets, we can really alter everything that we want to about the smile frame. This is the bit that we really want to start discussing with patients. In the DSD app, we've got all sorts of different shapes and sizes of teeth. And we also have the ability to use smile donators. So here we have true 2D taken from 3D files of individuals who have donated their smiles to the software. So this is the sort of thing that we can go through with patients and be able to discuss the sorts of tooth shapes and positions that they might like, and actually be able to relate it to smiles that they really like. We can zoom in and out of the full face of the patient, and we can also access video, because a lot of the decisions that we're really going to make about where should the incisal edges be and how long do we want teeth to be in relation to the face, we're going to need to look at the smile videos to consider lip position, phonetics, and obviously we need to consider occlusion and function as well. So within the app we have the ability to try on different shapes of teeth, different types of smiles. Once we've decided on a scenario that we're happy with, I might just move this down a fraction. And just curve this up into here. We can mix shapes and we can adjust shapes, but once we've decided on something that we're happy with, we then just mark the detail of the lip, because the software is going to slip the teeth underneath the lip. So we need to know exactly where that lower border of the upper lip is so that the resulting image looks as good as we can. We can then select different colours for our teeth, and we can alter all of these colours as well. We can adjust colours, we can blur the teeth slightly so that they're not as sharply in focus and match more the rest of the teeth. We can increase brightness, saturation, warmth, all of that. There's a gum layer and also a stamp tool that we can rub out. I'm not going to have time to do it just now, but if I wanted to just edit where her own tooth was showing, we could do that. So then we have the ability to show the patient very easily a motivational image designed very quickly in 2D, but to help them visualize how they could look if we went through the changes that were possible. We can show the patient a before and after, and we can also whiten the lower teeth if we want to do that as well. So that's just a very quick rundown of how I would work with smile design, digital smile design, and patients. It's very easy to do this next to the patient on an iPad. You can involve your patient in choices such as the size of teeth, the different shapes. So if there's pictures of them when they're younger, if they've got relatives that have similar shapes of teeth, then we can capture those with our intraoral scanners and import those into the library. So there's a whole wealth of ways that we can involve our patients in this procedure. Obviously, we then need to have the treatment plan and make sure that we're not giving false promises. So it's very important that patients understand this is an image, but that we will follow it up with proper diagnosis, analysis, and treatment planning, and then be able to discuss with them the risks and benefits of all the different sorts of procedures that would be involved. But I think aesthetic dentistry is such a visual subject that we need to be able to show our patients visually in order to help educate them and motivate them so that they can go ahead with achieving a smile that will bring them confidence. Thank you.
And that's the end of a superb doubleheader by Elaine, really taking that forward and moving into the new modern era with DSD and how to implement it. Join us again tomorrow.